Today's webinar is about what's new in terms of regulatory requirements and standards that are required, guidance documents. How do you know what's new? And how do you systematically go about making sure your manager review slides are up to date? So when you discuss that topic, what are the new and revised regulatory requirements for your management review? How do you make sure that meets the requirements? You don't want a non-conformity for this one. It's really easy to comply, but it's also really easy to make the mistake of missing something and getting a non-conformity that's easy for the auditor to write up. All they have to do is come up with one thing you're missing, and here's your non-conformity. So this is how to do it the right way, and I'll give you some hints on what the most common mistakes are that people make. Number one, make sure you have a management review procedure that tells you systematically what you're going to do to identify new and revised regulatory requirements. It's got to be in your procedure, it's got to be step by step, and follow the procedure. If you do that, that will avoid most of your problems. Number two, you want to make sure you address each country that you do business in. So what you do for the US market is not what you're going to do for another market like Canada or Europe or Australia or Japan or China. Whatever the market is, every single country has slightly different things you're going to look at and look for. And you have to itemize that out in your management review procedure. Maybe it's an appendix. So you could say, we're going to have a one-page appendix for each country that's sort of the checklist on how we're going to address that country. Really simple way. Rather than revising the whole procedure, just add something. And then if you have to change the countries, like we're no longer doing business in that country, remove that document. So it's easy to just add one page, subtract a page if you make a change to the markets you do business in. But having that one page as an appendix saying this is what we're supposed to check for in that country is the right way to do it. The next thing you should do is have a schedule for that. Now, I don't generally recommend having only one management review per year. The reason for that is very simple. If you have some sort of problem that occurs in the beginning of the year, and you don't have your management review until the end of the year, and it doesn't really matter what time of year, just many months later, it's kind of pointless to work on corrective actions or have a management review action item for something that happened 10, 11 months ago. The time to do something about it would have been 1 or 2 months after it occurred, not many, many months after, many quarters after. It has to be in a timely manner in order to be of much value. So have a schedule for when you are going to do manager reviews. I recommend quarterly. If you have a really busy fourth quarter, you might say, we're going to conduct at least one management review per year. Our quality objective is to conduct at least 3 per year. And at the end of each management review, we will schedule the next management review based on the need for management reviews, based on what's changing, what kinds of activities are going on in our business, what new markets we're going to enter, what problems we're having from a quality standpoint. It doesn't always have to be the same. It doesn't always have to be on the first Monday of the quarter. You can always decide at the end of the manager review, when is our next one going to be? And you say, this fourth quarter, we got a lot going on. Let's skip it. Let's not try to do something in December. Let's push it to January or whenever makes sense for your company. But saying we'll do at least one a year. And at the end of each management review, we will decide when the next one will be. And we will have a quality objective of having at least 3 is a really solid way to do it. That's what we actually write in our procedure. You don't have to do it that way, but that's what we recommend. Now, we've already discussed you have a schedule for your management reviews. We've told you how frequently you ought to do them, when you want to plan them, and we've said put in the appendix what you should check for each country that you do business in. Now, the last piece of this, you don't have to update all the requirements for all the countries all the time. If you're going to have 3 different management reviews in a year, you could say we're going to take a third of the list and do it at one time, do another third at the next management review, and the last third at the third management review. So you load level your workload for updating standards and regulatory requirements into thirds to match the three management reviews you do per year. Does it have to be done that way? No. You could do it in two different management reviews, or you could say we're going to do it all at one time. You could even outsource it. But at least once a year, you have to take on that activity. Some companies say, well, we're going to have a manager review multiple times a year, but we're not going to cover all the topics every manager review. That's okay. If it's an area that you only want to cover once a year, and this particular topic is only one you want to cover once a year, and you want to do all the updates at one time, that's fine. But that also increases your risk of something changing between the last manager review and the next one, which are going to be 12 months apart now, and you might have a submission that occurs in between there, and you might not have your testing up to date, and you might not have anticipated that change. So more frequently than once a year is highly recommended, but not required. So whatever your schedule is for when you're going to check the following countries, if you decide to do it once a year, you do them all at once. If you decide to split it into three parts, do so many, like one third of them at each time, that's fine. Just document it in a schedule, just like you would for your auditing. You don't have to audit all the processes all at once in one full quality system audit. You can split it up and spread it out over time, but you do have to document it in a schedule. That's the key. So now we've covered, you're going to have a procedure for this. You're going to have a schedule for manager reviews. We're going to have appendices in the back to say what we're going to look at for each country, which countries you're going to look at, and what schedule you're going to have for updating them. Then, if an auditor says, well, you didn't identify this guidance document or this regulation was updated, you should be able to go back and say, well, that change occurred on this date. The last time we checked that, according to our schedule, is supposed to be on this date, and that was before that change was announced. So during the next time that we are scheduled to review that, that will be caught. So we followed our procedures. We can't run a business and 24/7 be checking updates to regulations and updates to standards. If it's something important and critical, the government should be notifying you of it. So the FDA has these email services where they will send you email updates letting you know of important changes. That's one way you should learn. Another is you might have a service that you subscribe to letting you know of updated standards. You might check more often. You might have somebody that's responsible for that particular area of expertise, let's say biocompatibility or sterilization, and they should stay up to date in what's going on in that field. So they should be aware when a new standard is released or a new guidance is released because they're the expert on that topic. So it's very unlikely that if you're checking more than once a year on these standards and you're following a procedure and systematically looking these things up, that you're going to get caught with, oh, we didn't identify that. Now, the last part, and this is the part where people really fall down. Even if they have identified, we're going to update it this frequently, and this is what we're going to, this is what our checklist is supposed to be. The content of that checklist that you have in the appendix is really important. There are basically three different elements you have to have. The first element is you have to look for changes in the regulations. Some people don't even know what the regulations are. So, for instance, in the US, it's not just 21 CFR 820 that you have to pay attention to. You have 820, which is the quality system regulations. You have 803, which are the medical device reporting regulations. You have 806, which are the corrections and removals or recall regulations. You have 830 for UDI regulations. You have 812 for investigational device exemption regulations, and the list goes on. So every single one of these different regulations could have an impact on your business, and you need to know which ones are important. For most medical device companies in the US or even outside the US, the four that I listed are the most common: 820, 803, 806, and 830. But if you do investigational studies or a clinical study, 812 would come into play as well. So that's usually the list for US for the regulations. If you were in Canada, it's SOR 98282. If you're in Europe, you have two different possible regulations now. It used to be three directives. Now you have two regulations. You have regulation EU 2017-745, that's for devices, and then EU 2017-746 for in vitro diagnostics. And you have to know which one applies to your company. And in some cases, both apply to your company. And you have to know when those are updating. And there are transition periods that are applicable that have not taken effect completely for the IVDs, but all the ones for the devices have come into effect. Next, after the regulations, we have the guidance documents. Every single country has its own guidance documents. There will be, there is going to be below this video a bunch of hyperlinks to articles, one about the US, one about Canada, one about the EU. All three of those are old blogs, so I need to update all three. Just like you need to update your new and revised regulatory requirements, our hyperlinks on how to do this and where to find the information is outdated now. So we need to update that. So I'm going to update each one in sequence, and then we're going to update that for our client that has asked us to help them with the new and revised regulatory requirements. Yes, it is something you can outsource. But knowing where the guidance documents are for Canada is different from where they are for the US FDA, and it's also different from where they are for Europe. And they sometimes change because just like our company changes our website and you change your website, governments change their website as well. And they may or may not do a great job of redirecting like you would on your website. So all three articles, I'm providing hyperlinks down below, but all three of them will be redirected to new blogs automatically. So if you click on the old link, it should take you to the new one. And we're also going to be updating the YouTube links at some point as well. So we'll go back and correct them so they're showing the new links. The third piece is recognized standards. A lot of companies will sign up for a service that will tell them, hey, this standard has been updated. Do you want to purchase it? And so they'll offer that as a free service and they'll notify you and send you an email when that's updated. However, that's not the only way to find out about new standards. In fact, some of these standards require planning in advance and coming up with a quality plan that might be a significant burden for your company, particularly if you're a large company. If they change the sterilization standard, think of all the sterile products you have that might need requirements for updated sterilization validation. Or maybe it's biocompatibility, or maybe it's some other standard. But whatever it is, you need to kind of know about these coming in advance. So how do you know? Well, there are committees that are identified for we're going to review and update this, and they have a schedule. You can watch they'll actually have like a TC 210 is for ISO 1345, and you can go up there and you can see what quality system standards are changing, when are they changing, what is the status of that subcommittee, and you can see, oh, this is when this draft is coming out. You can actually purchase the drafts. So it's often called the DIS, like the D ISO standard or ISO. I forgot. I'll put the link down below for what it is. But I've done this before for 14971 for risk management. They had a DIS version, DIS version, or draft version of that standard that was available for purchase that you could look at a year in advance of when the actual standard came out. And a lot of people were like, well, is this updated to it? It is updated, but there were a couple of differences in the wording that they used in the final version, but the requirements are the same. It's the final wording. So we're looking at the difference between, somebody went back and did grammar checking and corrected typos and made something sound a little bit better, but they're not fundamentally changing the requirements when they go from a draft version of a standard to the final published version. The date changes, but not the fundamentals of it. So when you're writing a procedure, unless you're quoting verbatim exactly every single thing in there, instead of writing your own procedure that says how you comply with the standard, which isn't really the intent, as long as you're paraphrasing, you shouldn't have any problem using a draft standard to create your updated procedures well in advance of the new standard being released. That's also why some of these standards don't have any transition periods. Just because the FDA says, well, we recognize both of these and you have 3 years, doesn't mean all countries are going to give you that timeline. Sometimes they have no transition period and you have to comply right away. So you have to keep that in mind. Health Canada doesn't recognize all the standards out there under the sun. They actually have a published list of these are the ones we recognize. Same with the FDA. There are some 2020 6601 electrical safety standards that the FDA doesn't recognize. They only recognize the US version of the standard, which is older and doesn't include some of these newer changes. So you have to keep in mind what standards do the countries that you market in actually recognize, and you may have conflicts, and you have to come up with a plan for how you're going to address those conflicts. We have somebody that put in a question: can we club the management review if we miss to conduct any one? Let me read this. I apologize. The wording of this is a little difficult. Okay, so if I'm understanding the question for this person, they were asking if it's okay to conduct an area of the management review in one quarter because of a priority or unavailability of the management team. So if you have multiple management reviews in a year and somebody is unable to attend one of those management reviews, there's going to be some things that they miss. You should have a policy for what you're going to do when people miss meetings. You can't predict when people are going to get sick or when something bad is going to happen or something good is going to happen, and they can't be available for a meeting. And so, what are you going to do about that? One of the things I do, I record the meetings, I offer a Zoom link, and then we ask the person that wasn't able to attend to review that and submit any questions before we finalize the meeting minutes. So that's how I address somebody not being available. However, in the 2016 version of 1345, they made the requirement when you identify new and revised regulatory requirements, it's not sufficient just to identify the change. You actually have to come up with a plan for how you're going to address the change. So, what you should be doing is assigning as an action item from your manager review, this person is going to create a quality plan. And there should be a subsequent meeting where you're actually going to present that plan and take additional actions or open up CAPAs. So it's not enough just to say this has been updated. You actually have to come up with a plan and document that you've come up with that plan and when it's going to be and who's going to be working on it. So even if somebody misses a meeting, they can't completely miss that you covered that topic. There's still action items, there's still CAPAs, there's still quality plans, and they should keep on going even if the person wasn't involved in the manager review. You don't necessarily have everybody in your company involved in the management review. The bigger companies only are going to have a small meeting of 10, 15 people, not meeting of hundreds of people. And if you don't cover every single topic every meeting and somebody can't attend one of those meetings, you have to address how you're going to address absenteeism in those meetings. If there's an action item that can't be addressed because somebody is absent, put it in the manager review as an action item and follow that just like you would a CAPA. That's how I actually do it. I actually have a CAPA log, and then I have a separate tab that is manager review action items. So they're both in the same document. They're just different tabs of an Excel spreadsheet. So you keep track of different action items that way. You don't have to do it that way, but that's how I have done it. I hope that answers your question that you put in the chat there. If you have any other further questions, don't hesitate to contact us on our website on the contact us page. You can either schedule a meeting through Calendly or you can send contact to me by email. That works fine. And stay tuned. The links below right now show you the old blogs that were talked about how to identify updates to the FDA, to Canada, to Europe, because those are the three markets that we cover. And the strategy hasn't changed. The methodology hasn't changed. What's changed is the hyperlinks. The hyperlinks are out of date because the websites have all changed over the last 8 years since I wrote those blogs back in 2014. So it's almost been a decade since I first started writing about how to do this new and revised updates to manager reviews and how to do it correctly. So I hope this was helpful to people out there that are constantly struggling. And I want to leave you with one last point, and this is important. Keep in mind, no matter what you do, you are at a disadvantage to your notified body. Your notified body every single week goes around and visits multiple companies, and every single one of those companies has a manager review, and they reviewed new and revised regulatory requirements. So this auditor that is in front of you has looked at it for a whole bunch of other companies like yours, knows what they identified. Plus, they have their own training that they're going through for the notified body that makes them aware of things proactively. So you have both of those competing against whatever efforts you've done. So if you're just doing a quick check, you should not be surprised that you're missing things. You really have to have a procedure and follow that procedure. So that way, if there's a gap, it's one of two things. Either you didn't follow your procedure, or your procedure is not up to is missing that requirement. So the corrective action would be update your procedure so it includes that step. And I suppose a third item is it occurred after the last time we did an update. So let's say we had the manager review in July, the change we checked for this new and revised requirement in June on this date, and the change occurred 10 days later, and that's why it wasn't covered in that manager review. In the next cycle, it will get caught because we'll follow the procedure just like we did before, and we'll catch that. And if it's something really important, it would be caught one of these other methods. So I hope that's helpful to you, so you can avoid a nonconformity for missing a new and revised regulatory requirement. But most of the companies I see, the issue is that they just don't have a process or just didn't have the bandwidth to go and do that activity. And they kind of relied on memory. I don't know of any new or revised regulatory requirements. That's very seldom the answer. There's almost always a new and revised regulatory requirement for every country. Thank you very much, and I hope this helps. And I'll talk to you next Friday when we do our next live streaming on YouTube. Bye bye.